he had this strong erection. For some reason, when guys can't get something, they want it.
Yeah, I remember he was watching the gardening channel.
Yeah. Yes. Yes. You
The
remember.
home improvement.
Yeah.
Like, yeah.
So it woke him up at 2. He turned on the home TV or whatever it is.
HGTV.
HGTV, yeah. And he said 2x2 or the 4x4 like looks sexy. And I was just like, oh my God. I mean, I enjoy surgery in general.
Mm-hmm.
But what makes penis so enjoyable is because it's like a canvas. It's a real life canvas. And you've seen some bad canvas.
Mm-hmm.
And somehow when we turn this canvas into this art, it really is an art. Because my partners would try, but somehow theirs would just not look good.
Love is priceless, take it to the moon. Priceless, one day will be soon. Love is priceless.
Hey everybody, welcome to another episode of D-Talk. So today, we're going to talk about a day in the life of DNA, not DNA. I know I'm, fresh off the boat, but not DNA, D, and then ANDA, Dung and Alex. Okay. And so I have to give you the disclaimer. Medical advice I do give on this show is just purely that. If you think you have something, you need to get it checked out by your doctor. Don't use what I say for treatment. So I have to put that disclaimer. And then obviously I'll remind you guys at the end, but hit the subscribe button. It'll really help us continue to do what we want to do. And, we'll see how it goes, but I'm starting to like to bring Alex on as kind of a co-host. Alex pretty much is with me all the time, and she's a natural at this, And so today, I think one of the audience member messaged us and asked us, kind of how does our day go? And so, and what's the most satisfying part of our day? And so I think, let's start out by, let's put some context to it. So let's find out with Alex first. How did you ended up wanting to be a surgical assistant?
Well, when I was in high school, I was about to graduate and I wanted to go into medicine.
Mm-hmm.
I for sure knew that I did not want to be a nurse.
Mm-hmm.
And nothing against nurses out there. That's just not what I wanted to do.
Mm-hmm.
So I was looking through the college and the programs that they had, and I saw that it said surgical technology. And so I looked it up and I did my research and I liked it. I liked what entailed, and you were going to be in surgery and this and that. And so I was accepted to the program. I was the youngest.
Oh, wow. How young were you?
I was 18, about to turn 19.
What's the average age that people go to surgical technology school?
Oh, I think I was 19. I don't know. It's just mostly in their 20s or 30s. I know we've had students in their 50s, 40s as well.
Wow. Do you ever ask those students why they changed their career at such a high age?
I have, and they'll say I didn't want to be a paralegal anymore. I was done with the office job. I wanted to do something else.
Right.
Mm-hmm.
Okay. Well, for those who may or may not know, no joke. How did they score the SAT in the past? Was it 1600 was the highest?
Something like that. I don't 18?
Is it 18?
I don't know.
Okay. So I don't know what happened. I was always the black sheep of the family. I think I scored like 840. I don't think you can score below 840 on the SAT. and you know, my parents, you know, my mom only graduated 4th grade, but one of the smartest lady I know. My dad graduated 12th grade, and then, you know, we immigrated to America, and then you came from in 81, right? Is that what you said? From El Salvador?
No, it was 92.
92. Yeah, because you're not that old. 92. Sorry, I got confused. So I came over in 83, and then, you know, my parents, my dad went to trade school, and then my parents, my mom cleaned house and was in the restaurant business. There were 6 of us, and so my parents obviously weren't really home to kind of tutor us. We kind of had to tutor each other, you know. Yeah. And I don't know if anyone's ever worked in a convenience store, kind of like Boys in the Hood, the movie. That'll toughen you up real quick. And I think what changed my life was when my parents go, if you don't go to school and get an education, this is what's going to happen. And then from there, you know, I went to junior college, and then, I don't know, something happened. I got lucky, and here I am fixing penis.
So how did you become, like, I know you went through urology and all of that, but now your specialty is penis. How did you become a penis doctor?
You know, originally I wanted to be a urologic oncologist, but you worked with me long enough. I'm like a big kid. And I just, I couldn't handle seeing people kind of pass away, you know. And even though my older sister, she does breast oncology, and you know, my younger brother, he's also a urologist, and he likes cancer. I don't know like how I ended up, just, it's more like an art. I guess I've always liked to draw, but I could never draw, except when it comes to the penis. So
you have that down to a T.
Yeah, I have that down to a T. I mean, we have it down to a T.
And when you're drawing, you can draw it upside down.
Yes, I can. For those who see my previous episode, yes, I could draw the whole urinary system upside down. I would have to say I rotated through a local children's hospital here in Houston, and I really enjoyed it. I enjoyed it because, I mean, I enjoy surgery in general, but what makes penis so enjoyable is because it's like a canvas. It's a real life canvas, and you've seen some bad canvas. And somehow when we turn this canvas into this art, it really is an art, because I try to show my partners how to do it, and they, you know, I literally got shafted, no pun intended, because my partners would try, but somehow theirs would just not look good. And even though my partners are guys, they just hate penis, which is such a paradox. I don't understand that. Well, first of all, I'm not a penis surgeon. I'm a brain surgeon for men. Let's get that straight. I got more class than that. Not much more, but a little bit more.
Well, the funny thing is that I like women, and I texted you the other day, and I said, I like working on penises too.
I know. There's something about it. It's just, I don't know what it is. There's something about taking a penis that, and trust us, there are days we don't get home till 8 or 9, sometimes 10. But it's so satisfying because we're taking something that somebody else is messed up. Not to say that they did a bad job. It's just some penis surgery are just very tough. I mean, let's just leave it at that, you know? and from whatever reason, they got misdiagnosed or it got botched, or the surgeon really did try his best, but
It broke
it
down.
broke down,
The incision, yeah.
yeah, patient factors, so I don't ever, one thing we don't do is we don't talk about other doctors and we don't talk about other people. Like we kind of just stay in our own lane. If patients come, they want us to fix it. We realistically just tell them all we're going to do is, we hate to sound like stockbrokers, but past returns does not, past results does not promise future returns, but for the most part, I think we do a pretty decent job.
Yeah.
And there's just something about fixing it. And, as a parent, especially with you, parents to 4 boys, if, thank God, none of your boys have any issues, but if they did, I think you and Aaron will be devastated.
Yeah.
And so, luckily in Houston, we have good doctors that can take something and transform something, and so one of the, I guess, so when I rotated through this children's hospital, for some reason, I was really drawn to, don't get me wrong, I love surgery in general. But there's just something about penis that you get this satisfaction of turning something that is just mush, is the best way to explain it, into something that legitimately, looks like that, and the part where where we reveal it to the parents by taking off the diaper so they could see. A lot of these parents would gasp. Like, especially, remember that 17-year-old we did?
Oh, yeah.
Yeah, like he was depressed.
Yeah.
Yeah, he was depressed. He was 19. He had a 2-inch penis, and he was questioning, like, was he really
A man.
Yeah. But he's definitely a man. He was like 6 foot tall.
Oh, he was very tall, and
yeah,
he was Vietnamese.
he's Vietnamese. Yeah. And when he went in to see us, I don't think you were there yet, Alex. Yeah, when he went in to see me for consultation, he was just so withdrawn. And I felt so bad because I asked him, like, what was bothering him, and he's like, nothing. Nothing. He just wants, I don't know, his mom said, take him here. And so it was just really bizarre. And so I examined the child. I call him a child. He's 19, and it turns out, but you were there with the surgery, obviously, because Alex helps me with everything. And he literally had like a 2-inch penis. And when he was done, he was 7-inch. 7-inch. He went from 2-inch to 7-inch. Now, guys, don't start getting ideas, though. All right, not everybody can get 5-inch. Okay, we'll go into that later. But there is a study that shows that this one of my partner told me. I can't independently verify yet, but he did tell me there's a recent study, that came out that basically says across all races, I think the penis size, what did Brian say, was only Brian's my other partner.
I think it was 1% or 2%.
1 or 2%, or 1 or 2 inch.
I think, yeah, like 1 inch difference.
Yeah, like 1 inch or 1.5 inch difference, something like that, right? And I was like, no way. But then the more I thought about that, the more I'm like, you know what? That is true. In African Americans that bury penis, I can't seem to bring it out as much as Asians or Hispanics, and certain Indians, and the ones I'm talking to. I know you're listening to me right now. I'm just kidding. But yeah, so anyway, so this kid, like, I keep calling him a kid, but he's not. He literally was, after surgery, I mean, even his mom was shocked. And, you know, I think I called them 3 or 4 weeks later to see how he was doing. Just, just a random call,
Mm-hmm.
just to see, like, hey, because I felt bad for the kid. He was in college and he was
Yeah.
just withdrawn.
Yeah, he was on antidepressant and all.
Yeah, he was on antidepressants and all that, and which he shouldn't have been because we fixed the problem. I think he's off of all that now.
Yeah.
But he kept looking at it, and his mom's like, "Doctor, is that normal?" I go, "What do you mean?" Mom goes, "He's like looking at it every day." And I said, "Like looking at it, like trying to clean it?" She's like, "No, like he's obsessed with it." And I go, "What do you mean? Does he have a girlfriend?" She's like, "No, he just looks at it." And I said, "Okay, this doesn't make sense." So I'm like, "Okay, hand me the phone, Mom. Put him on the phone. Let me talk to him." So I talked to him. Let's just say his name is
Mike.
Mike, and I'm like, "Mike, what's going on? Your mom says you keep looking at it," and it's like a totally different person on the phone. He was like, "Oh, hey, Dr. Pham. No, no, I'm not doing something strange. It's just, is it really going to stay like that?" And I said, "Yeah, why wouldn't it?" He goes, "So it won't like go away? Like I'll be back to 2 inch?" I was like, "No, this is not like a car. I can't go repo your penis. If your mom didn't pay for the surgery," well, I mean, she did, but even if she didn't, I can't go repo it.
Mm-hmm.
Yeah, and I told him, I said, "Listen, that thing is yours. Do whatever you want with it. You can, whip it, beat it,
But not yet.
dress it. But my suggestion is go to
He
college."
wasn't cleared yet.
Yeah, he wasn't clear yet.
Mhm.
Yeah, and and I told him, yeah, that's right. That's what it was. I told him, I said, you can look at it, but don't beat it, don't don't whip it, don't pet it, don't do anything to it. Just leave it alone. But if you want to look at it, that's fine. But I told him, like, no, that this is yours. So that just tells you how much this changed a guy's life. And then they finally weaned him off the antidepressants and all that. But what I never got answered was, why was he even put on antidepressants in the first place?
Mm-hmm.
Like, why did he not tell his doctor that he questioned, is he really a boy? And he said he did. Well, then why didn't the psychiatrist do a physical exam? Well, I guess.
Well, I don't think they actually do physical exam, but maybe if he would have talked to like his PCP or something,
Yeah.
like they would do a physical exam.
Yeah.
Mhm.
But you'll be surprised because,
Oh.
there's a lot of PCP that, penis is just such a specialized disorder,
Mhm.
But I don't know. I rotated through this hospital for only 2 months, and I just really, I like the fact that nobody died. Yeah, like, as important as penis is, if you have like brain injury, lung, heart problem, I think, we got to prioritize. Now, I know guys think that this is their brain, but really, all joking aside, it's not. But it does play a big part in their life, but we just really need to prioritize, And so typically the patients we operate on are fairly healthy.
Mhm.
If they're not healthy, I would recommend that they get healthy first. Yeah,
yeah.
because,
Mhm.
but, I know for a fact that nobody died. That's why I kind of enjoyed, pediatric, not just pediatric, but even adult reconstruction. And the more complex, the more satisfying,
Mhm.
But
Yeah, because you can see an instant change.
yeah, I
And
think that's what it is.
And it's a drastic change.
It's a drastic change,
Yeah.
right? I agree with you. And I think the longest one we made was, I think he was 3.5. You remember?
Mhm.
And then we got him all the way up to 9. He was 9-inch resting, and literally his wife, she did not have a look of happiness. She was like, "What? the heck is going on? Um, and so, and keep in mind that after, penis elongation surgery, you still have to add another 1.5 inches or
Yeah,
so
because
to
it'll
accommodate.
stretch.
Yeah,
Yeah.
because you have to accommodate the stretch. And she wasn't happy at all.
She
But
was scared.
she was scared. Yeah,
Yeah.
that's a better way to put it, because you were there. I mean, it
Mhm.
was a monster.
Mhm.
And I know before surgery, I'm like, okay, do you want a little 22, or you want a 44 Magnum? And his wife is like, 22. And he's like, I already have a 22. I want a 44 Magnum. And I'm like, are you sure? And I remember this patient distinctly, because I told him, I said, listen, if I put you on full stretch, because remember, he had all this skin. That's the only reason. That's the only reason why we were able to make it that long.
Mhm.
But I told him, I said, however, I personally never had the surgery, but the first 7 to 10 days or so is going to be very painful.
Mhm.
And he was like, no, doc, yeah, all the way, like all of them, all the way, whatever, 737, whatever, F-35 stealth, whatever you name it, they're like, all the way. I was like, all right, are you sure? Because I give you until the last minute to make that decision. And the wife, can't call in and tell me, hey, can you make it a little shorter? Because technically he's
the patient.
He's
He
the patient,
consented,
yeah. And I remember he was doing fine until like day 5. He had this strong erection. For some reason, when guys can't get something, they want it.
Yeah, I remember he was watching the gardening channel.
Yeah. Yes. You remember.
Home improvement.
Yeah.
Like, yeah.
So it woke him up at 2, because he had this really strong erection and it hurt. He's like, oh my God. He's like, I've never felt anything like this. And this is a tough dude. So he turned on the home TV or whatever it is.
HGTV.
HGTV, yeah. And he said the 2x2 or the 4x4 like looks sexy. And I was just like, oh my God. So anyways, he ended up doing fine. And then I think I cleared him around 6 weeks later or something like that. And then I spoke to him about 3 or 3.5 months after surgery, and I asked him, what's your final length? He said 10.5. And I was like, whoa. Now that's because he also had a curve, remember? If he didn't have that curve, he would have been like 11.5. So,
and the good thing, he wasn't circumcised, so we had all that skin to work with. Yeah.
So remember that, guys. How long I can make it. And with Alex, we purposely don't post our surgeries, because it is a business, right? And we really don't want people to know how we do it. It's not magic, but there is a lot of tedious work into it. Yeah, and we perfect this over the years, but don't think that you come in and you can be like, add another 5 inch to it. It's all about the foreskin. And so, unfortunately, a lot of patients are already circumcised. Yeah. And so, but I think what really, and I think that's where the name Penis King came from, because I was thinking about it, because someone did ask me, like, where I didn't give myself this name. Somebody gave me this name. And I think it was back in 2015 or something. It was all over the news that, some mom, slice off her son's, penis or whatever. Sad story. And I'll never forget that day. I think I was walking out, and it's all over the news. So, this is not like, anything special. It's more sensationalized, I think. But yeah, I think what really captivated me was, I remember that time I had a PA, so we had finished, and I think it was around 5 or something, fixing to go pick up Oliver. For those who don't know, follow, Oliver's my older son. He's 9 now. And so basically, you know, this kid was getting stabbed, and a UPS, from my understanding, a UPS driver was driving by, and he looked in the rearview mirror. This is what the news reported, and he thought they were playing until he looked in the rearview mirror and realized that the mom was stabbing him, you know. And so he pushed the lady off, called 911, and a helicopter came and took him to the hospital. They were able to stabilize him and everything. And the funny thing about penis is, you know, even when you slice it in half, it can tamponade itself.
Mm-hmm.
So you may not even know that, you know, that half a penis is missing.
Mm-hmm.
Yeah. You know, and especially if you're in a trauma situation, there's probably like 30 people in the room.
Mm-hmm.
So, you know, they put the Foley in and all that. And the helicopter people, you know, Life Flight, there's multiple companies, but basically they're trained any sort of tissue, just go ahead and put it in ice, I guess.
Just
and
take it.
Just
in
take
case,
it, just
yeah.
in case, yeah. And so the charge nurse at the time, she's no longer there. She actually looked into the trash can and she saw what looked like half a penis. And so they paged me and they said, "Hey, Dr. Pham, can you come back to OR so-and-so?" And I said, you know, and it's not important what hospital. And so I said, "What?" And I'm like, "Come on, guys, I'm tired. This is like, you know, like you're joking around, right?" And so you know, I said, "Why don't you put the charge nurse on?" Because she doesn't joke. So I put the charge nurse on, and charge nurse like, "No, Dr. Pham, we're not kidding. Like, there's a penis."
Mm-hmm.
And I was like, "Okay, I'm coming back." And so basically I came back and I looked in the trash can and it was that. I was like, okay. But from 1 through 10, and I'll tell you what, I've never met 10 because if I did, then I would retire, right? And so I would just classify that surgery to reanastomose as probably a 5. You know, I can't remember how long it took me, probably a couple hours.
Mm-hmm.
You know, you really don't have to reanastomose all the vessels and stuff. You know, you reanastomose the urethra and the corpora and stuff. And the kid ended up doing fine. Erections fine, had penis ended up being fine. He had some venous congestion, but, you know, he did fine. But I think after that, one of the nurses, and I remember the CEO came up to me the day after and he's like, "Hey, thanks for doing an awesome job." And I was like, "Sure, you know, I mean, that's my job is to, you know." And then I think that sealed the deal. And then I think from that point on, that's when they call me the penis king, you know. And so, and then, which was bad because that's why I think I have arthritis in my hand because, you know, when you do the circumcision, the nursery circumcision, you would have to clamp it down really hard. You know, there's 3 ways of doing it. One is the plastibell, which is you just put that plastic piece on, tie the string really tight. Those are mainly used by people who, you know, are nervous about putting in stitches if there's bleeding and stuff, but you have to wait for like 10 or 14 days or so for the skin to necrose off.
Mm-hmm.
The second is it's called the Mogan clamp. That's like a cigar cutter. That one I would never use because you can accidentally cut the head of the penis off.
Yeah, I can see that.
And so, and if you have a urologist there, then, you know, they can take the kid back to the OR and reanastomosis, but chances are there probably isn't going to be a penile reconstruction urologist there.
Yeah.
You know, and so the safest one is probably the plastibell, but you know, you got to wait until 14 days to fall off. Sometimes they don't fall off and all this. So I like the Gomco, which is the one where you just kind of put it on the head of the penis. You kind of estimate the size, and then you have to crank it down. And so I remember at that time, once that everybody knew, like, I was the penis guy, like all these OBs were like, "You know what, we only want Dr. Pham to do our babies, you know, the babies they deliver."
Circumcision, yeah.
Just imagine doing 80 to 100 a month. I mean, it was just, to this day, I think I still have arthritis. But I think after that, I kind of just, I don't know, I was just really fascinated by reconstruction. because like you said, it's instant gratification, and it's just, there's something about helping a guy or a parent, through that, because it's going to become a big part of a guy's
Hmm.
life.
And it is a big art, like you say, because it's kind of like a puzzle. You have to find how to rotate this, rotate that, cut this, cut there, and to bring it together and make it look really nice.
Yeah. Oh yeah.
And I know like they're babies, but I know that in the future they're going to be, this is their manhood, and it's going to be very important to them.
Right. Because I think I remember you telling me, like, because I think after probably age 5 or so, nobody ever looks at it anymore.
Hmm.
So by the time they go to high school, it's like they're like, wait, why does mine look, all,
Different.
yeah, all funny. I remember there was a funny story about the brain surgeon for men. So there was a patient, we were at a outing, uh, kind of like a formal outing, and I was scheduled to operate on this patient. And his wife is, I guess, a big feminist or whatnot.
Hmm.
And so, me, I'm like a little kid. And so he introduced her. He's like, "Oh, hey, honey, this is Dr. Pham." Um, she didn't know that she didn't accompany him. Most guys come by themselves, they don't come with their wife. And she, like, literally got really lit up when I said, "Hi, I'm Dr. Pham. I'm a brain surgeon for men." And she, like, ripped into me like, "You don't operate on women at all? Like, this is 2023
Oh,
and all
because she
this."
was a big feminist.
Yeah, and I was like, "Oh my god." And then so her husband had to calm her down and go, "Honey, he's joking." And then number 2, he's about to put a knife to it. This is the last guy I need you to upset about. And so it's but I think it's, really kind of what you said. I think it's the art that
Hmm.
really kind of makes me like to do what I like to do.
Hmm.
Yeah, and the fact that, we don't, we change up our techniques as we see complications arises.
Hmm.
Yeah, like we don't just blow it off like, "Oh, well, it's just another."
Yeah. Oh, it's the patient's fault or whatever.
Yeah, it's the patient's fault.
Yeah.
Now, some of them is, remember that guy that basically he probably was 3 or 4 weeks out, and he came back, and the whole, the kind of the basis of all penis reconstruction is deglovement, which means peeling the skin down. And this guy, we had fixed him, and then 3 or 4 weeks later, or maybe even 2 weeks,
I think it was 2 weeks.
yeah, he came back, and the whole thing just
Fell apart.
ripped down. Yeah, and there's got to be at least 20 stitches holding it
Mhm.
together. And so I asked him, I was like, "What happened?" And he's like, "I don't know, doctor. I was just watching Netflix and it just fell down." I mean, literally, that was the face I had from him. I was like, "Listen, if I told you that, no insurance going to cover that. There's no such thing as you sat down and the whole thing fell down." And so finally I said, "Listen, I've seen it all. I heard it all. I just need to document it correctly so that the insurance will pay for it."
Mhm.
Yeah. And then so then at that point, then he's like, "Yeah, I was feeling good, and, did what I probably shouldn't do. And here we are,
He
and
was
so,
Netflixing and chilling.
yeah, definitely he was chilling. And so, and then children tend to always be easier to operate on,
Mhm.
and just the look on, because I remember one time we were operating, and during the pre-op, I was pre-oping, asking, do they have any questions, anything like that. and the dad was just real quiet, like just real subdued, and I was just like, maybe he just didn't sleep well or whatnot. And so the next, I did the surgery, everything went well, it came out, and basically he had like severe hidden penis. And so, I guess the mom was blaming the dad, when really it's not. We don't even know
what causes it.
Yeah, what causes it, And so, but what was funny was when it's like the ultimate reveal, when you open up the diaper, usually the universal reaction from the parents is always like, whoa. And then basically the dad jumped up and it's like, I told you so. It wasn't me. I told you so. And I was like, whoa. I was like, calm down. We're in the PACU. Y'all need to, calm down a little bit,
Yeah.
But yeah, but back to the topic, so one of the patients, not patients, one of the guests emailed and asked, kind of like a day in the life of what we do. Yeah. And, it's just fun. Like for me, it's just fun, like, yeah, it really doesn't take long and it's just something magical about, yeah. And some of them, it even shock ourselves.
Yes. Because sometimes we'll do ones that look like a belly button, like an Audi belly button.
Yeah.
And then at the end, they have a little baby,
Yeah, they have an actual shaft. Yeah.
So it's impressive.
Yeah. And yeah, and I think, that's truly what I'm more passionate about, I think, than anything else. And so, but I think that's the reason why is, like for me, it's not really a job. And I think for you, the same thing.
Yeah.
Probably it's more of a passion,
Yeah.
I mean,
yeah, because I know like you're very particular and you'll cut the very, very tiniest skin. But if you don't do it, I'll tell you, you need to cut like right here.
Yeah. And then the adult guys who don't even wear loops are like, what are you cutting? It's like they can't even see it,
Yeah.
It's like, I'm pretty sure if they could, they probably would staple the penis together.
No, but like I know that it is so important to them. So that's why I also advocate for the patient.
Right. Oh, no,
Like-
you're a big advocate.
Like I'll be like, okay, no, don't cut a little bit more right here.
But you remember the end of the year? Oh my God, that's got to be the worst week of our life.
Yeah.
We did like what, 16 or 18 cases?
I think it was
on that?
18.
Oh my
were slammed.
God. It was the worst time of our life. I mean, it was, and I think the year before that was probably even worse.
Yeah.
Because,
So the year before we were finishing later.
yeah, we were finishing like,
Because I think we were doing, for some reason at the end of the year, we were doing like more complicated cases.
yeah, more complicated cases. I mean, we were fixing penises that were like U-turn, like literally U-turn. And then we were fixing one that, we were fixing some super complicated one. And I think from October through December, I think we left,
The earliest maybe like 7:30ish.
yeah, the early was like 7:30ish. We were just, 2022 was rough. 2023 wasn't bad until towards the end of the year. And then 2024 so far, it's
steady though.
It's steady. Yeah. It's supposed to be a slow time, and we really don't have a slow time, And so, but yeah, so that's kind of the life, and, and everywhere we go, everybody really wants to be in the urology room. For some reason, like, I don't know what it is. Like, I personally never experienced it. Residency's been so long, and I don't remember like surgeons throwing stuff, but just the stories we hear is like,
I think it's more of the older surgeons.
yeah.
But even surgeons your age, they're still throwing stuff. I just think they have anger management issues.
I do. And I think that's partly the reason why they wanted to become surgeon, like that's an out you know, like a way for them to express themselves. But yeah, everywhere we go, everybody always wants to be in the urology room because we're low key, chill. Like, I mean, I wouldn't change my job for anything, you know.
Yeah, me neither.
Yeah, because
Yeah.
it's just fun, and the funny thing is you never know what you're gonna find. I hate to make it sound like Forrest Gump, but it is a box of chocolate.
Yeah.
Like you literally, like it can trick you. Yeah.
Like even though we're doing the same procedures, it's different every patient.
Yeah, it's different for every single patient. Some patients, the skin is thin. Some patient, the skin is thick. You know, whatnot. But it's just, and I think that's for me, anyways. I don't know about for you, Alex, but for me, I think that's what makes it interesting. Is like every day, it's something new. You know, it's not like you know, the same old thing every day.
Yeah.
Yeah.
No, I like it because it seems like there's variety, even though there isn't, you know?
Yeah.
Because even though we're doing the same thing, it's different.
Right.
It's different for every patient.
Yeah, like I think literally we do what, maybe 10 types of surgery. That's it. Yeah, day in, day out. That's all we do. But it's like you can have one that can last 30 minutes and you can have one exactly the same that can last an hour and a half, 2 hours. You know, and you know, and I think that's what makes it fun is like the challenging, you know.
Yeah.
Now, you know, we'll kind of end it here by kind of grading these surgeries, you know, like, you know, I already said like amputation's probably 5. The hardest part is actually transgender surgery. And I don't do transgender in adults just because of, I think there's a lot of issues that need to be worked out first. And, you know, they are irreversible. You
Correct.
know,
Yeah.
hormones is one thing, but surgery is another.
Yeah.
Versus
It's permanent.
It's permanent, yeah. And versus in children, you know, they're born with chromosomes that are just, you know, abnormal. And I remember a patient that was actually born a girl, like all XX, but for some reason, no ovaries, no uterus, no testicle, just, you know, the clitoris and the penis have same origin, you know. And I think it took me 5 surgeries. They decided to raise it as a boy, but I had already warned parents that, you know, there's something called imprinting. And so, you know, he's going to have girl tendency. Yeah. And then, you know, when I saw him back, it took me a while. It took me almost 3 or 4 years to complete his surgery because you have to let it grow and stuff like that. And, you know, they raise him as a male, but like they always have to keep his hair short or else he'll look like a girl. You know, and it's just, you know, yeah. And
that's really sad though.
It really is sad.
Because like that, you know, that baby is going to grow up thinking something else or feeling something else, you know, versus if you raise them as a girl, they'll feel more natural. Like they're not going to fight the feelings of looking like a boy but feeling like a girl.
Exactly. And that's something we don't fully understand. So at the time, I know I told parents, like, I think it's better to fix it so that it looks like a girl down there, you know. But I guess the parents really wanted a boy, and now I can always reduce the, you know, you can actually reduce the penis. You just have to dissect the nerves out, you know, cut, sew it back. And then, you know, you've done the one with me before, right?
No, I haven't.
Oh, you must not have been helping me yet.
Yeah.
Yeah, we did one where it was a patient that had congenital adrenal hyperplasia. And so the clitoris got andronized, and so that's why it looks like a penis. Yeah, and so I just kind of free up the nerve, you know, cut
this section.
Yeah, and then sew it back together, and then I kind of reduced the glans penis a little bit, and then I use some of that foreskin to kind of make the clitoral
Oh,
hood.
hood. Oh, yeah.
Yeah, and then I also split that skin to kind of make the the labia minora, the labia majora, and but kids with CAH or congenital adrenal hyperplasia, they actually can have children.
Mm-hmm.
So the first rule is, for me anyways, is what sex you should be, are you able to, first question is, are you able to have children? Because if you are, then you need to be raised, or my advice is you should be raised whatever that like if you're a male and you can produce sperm that's viable, then I think you should be raised like that.
Mm-hmm.
And if you're a girl and then you can have like congenital adrenal hyperplasia and you can have children, then
Mm-hmm.
I would definitely go with congenital adrenal hyperplasia. With those patients, I would advise,
Raise them as a girl.
raise them as a girl.
Yeah,
because
they
they can
have
have
the
babies.
uterus and
Yeah.
ovaries.
Yeah. And so I don't think anybody's against that.
Mm-hmm.
I think it's the rarity ones, and then, and then in terms of the adults, yeah, like I said, I just think there's still a lot that needs to be worked out.
Mm-hmm.
And I just, hormones is one thing, surgery is just irreversible.
Mm-hmm.
I mean, once you cut it off, I mean, that's it. I can't
put it back.
Mm-hmm. Like, I mean, could we theoretically use some pseudoplast that we use when we fix curved penis, as replacement? It's feasible,
Yeah.
but I don't know how well it would work because it doesn't really have the sinus complex
Yeah.
in the corpora,
Mhm.
and so, well, we'll never get an IRB for that anyways, and they don't come that often anyways. Honestly, we don't have a lot of guys that come and tell us, "Hey, can you reduce me, doc?" It's
Yeah.
always the other way around, And for some reason, I don't know. Do you feel this? I feel like in the older patients, after they come back for their checkup, somehow they walk taller and they feel like they can't fit through the door anymore. Like when they first come see me, they're all like this, like, oh, it's just small. But then after you fix them, like 6 weeks later or whatever, they come back and they're like, "What's up, doc?" And the pants are already down. I said, "Pull your pants out back. We got to close the door first. And your shoulder didn't get wider. I didn't do shoulder surgery. You should still fit through the door." But it's just comical to me, like,
Yeah.
but that's just a testament to the kind of work we do, and to kind of get patients where where they want to be,
Mhm.
and so. But you have anything else to add?
No,
Alex?
I think that's it.
Yeah.
Yeah.
So, well, we really appreciate you guys tuning in. We got some exciting new shows coming in, and so and we'll do some cancer talk. I know there's been a lot of people asking about kidney cancer and all that, so that will be a topic I will address. And so once again, please subscribe. If you like Alex as a co-host, let us know, because I think she would be an amazing co-host with me on this, since she pretty much sees everything I see, and we're gonna try to mix it up to kind of have women topics too that you would know more about than I would. Just and remember, this show morphed into something totally different. It was originally meant for men's health, but then it just morphed into kind of helping everyone, and so but I would really love your feedback on, with Alex, because I think, I think I want to make her a permanent part of this, because I think Alex brings at least a female perspective
Mm-hmm.
that I don't have,
Mhm.
yeah. And so and then plus, she's authentic. We purposely made this show unscripted because we just feel it would be more real,
Yeah.
versus if we script it and read a teleprompter. I mean, everybody does that, and then at some point, probably mid-year, we'll probably start letting people phone in and asking, certain questions
Yeah.
or anything like that. I already have a feeling it's gonna be a bunch of how do I wash my penis before my wife finds out. Uh, now we're not very good at answering cheating answers, okay? So don't be coming in with that. We probably can help you with STDs, the right protocol. And so hopefully you guys call in with some interesting questions, but I have a feeling that there's gonna be a lot of those. And so, but that's okay. Call us in. Probably we'll start that mid-year. We'll make a number available, and then during the show, you guys can actually call in, and then we'll hand out prizes and stuff like that too. But keep in mind, this is only our 5th month. We have gone really high up in the ranks. We put a lot of work into this. So whatever you do, please subscribe, watch us, support us. Let us know if this is something you want to continue seeing, because if you do, then we will continue producing it, because it's not cheap. It costs, it does cost a pretty penny. This is not something that can be done free, so. All right. Well, this is Dr. Pham signing off, and until next time, and then also co-captain signing off,
See
the
y'all
penis queen.
later.
All right, take care, guys. Have a good Tuesday,
We
okay?
gon' do it like it's priceless. Take it to the moon. Priceless. One day will be soon. Like it's priceless.